And the last part is treatment. It's also the most important part in this class. And for the treatment, first of all, we need to grasp the treatment principle. It includes mechanical ventilation, treatment of the primary disease, and infection control, improve ventilation and tissue oxygen, and at last, treatment and prevention of further pulmonary injury and pulmonary edema. First, the mechanical ventilator. Mechanical ventilation is the most important treatment for severe acute lung injury, and the objective of mechanical ventilation is to improve ventilation and tissue oxygen. When inhaled oxygen concentration is more than 50%, the pressure of arterial oxygen is less than 60 millimeter Hg, or the pressure of arterial carbon dioxide more than 45 millimeter Hg. Mechanical ventilator should be applied to treat the patients. It often reflects the patient is in a severe stage. And there are different parts of intubation, and the specific type for each patient should be combined with age, duration of the disease. Intubation via the mouth is performed in a short time, and a small endotracheal tube can be performed via the nose in children. So as we can see, the trachea can be intubated via the mouth, and sometimes in the nose, via the nose in children, and the cricosynoid membrane, or directly tracheostomy, just as this patient. And the latter two require a neck incision. And the ventilation mode include the volume ventilator and the pressure ventilator. And the specific model depends on the different stage of the disease. And before we use the ventilator, the parameters should be set at first. And the parameters include the rate of ventilation, and the tidal volume of each ventilation, and the inhaled oxygen concentration, and the level of positive and expiratory pressure, we also call PEEP. And for patients in the severe stage, when the mechanical ventilation was performed for these patients, after the disease get better, the ventilator need to be gradually taken off and eventually extubated, and the endotracheal tube is removed. And during this process, we need monitor relative indicators and change the parameters of the mechanical ventilator according to the change of the disease. And during ventilator use, we also need to monitor the ventilator. The ventilator-related complications. The adverse events include the bowel trauma, the volume trauma, the anaphylactic injury, infection, and lung injuries were aggravated by ventilator. And this is a typical case for acute lung injury. This is a female patient. She is 63 years old, which was she was caused by aspiration after a lung-cancer operation, and at the early stage, although the inhaled oxygen concentration is 100%, and the arterial oxygen pressure is only 38 millimeter Hg, and due to the lack of oxygen, patients represent shortness of breath and dyspnea. And at this time, we give the patient a mechanical ventilator. And 9 hours later, when we monitor the arterial blood gas again, we can see the indicator was improved, and the oxygen pressure in the blood can rise to 56 millimeter Hg. Although the inhaled oxygen concentration decreased to 50%, and 3 hours later, the hypoxemia situation was further improved. The oxygen pressure in arterial blood rise to 65 millimeter Hg, and the inhaled oxygen concentration is also remained 50%. Eventually, the patient removed the recovered from the acute lung injury caused by aspiration, and the mechanical ventilator was removed about 1 week after the disease begins. So, as a life support, mechanical ventilator is very important for the treatment of acute lung injury in severe stage, and the non-protective ventilation for the non-protective ventilation, the application strategy is open the lung and keep the lung open. During the treatment of acute lung injury, in addition to the treatment of complications, for example, the use of mechanical ventilator, we mustn't ignore the treatment of primary disease, and this may affect the final success or failure of the treatment. For example, when a patient suffered from a mechanical failure or trauma, we need to relieve the pain and keep the chest wall stable. And for patients with rib fracture, the painkillers need to be used to relieve the pain and restore the rib stable. And for patients suffered from aspiration, we need to prompt gastric empty and or clear respiratory excretions. And for patients with operation, early resuscitation should be performed to prevent aspiration. And in patients suffered from atelectasis, encourage patients to cough and expectorate. Sometimes we also can use a bronchoscopy to remove respiratory excretions when necessary. And for shock patients, we need to supplement the blood and fluid. And for patients with pneumonia, we can use the antibiotic. And for patients with pulmonary embolism, thrombolysis can be performed in the early stage. Acute lung injury in surgical patients is usually accompanied by lung infection. Antibiotics is very important to control pneumonia, and in the initial treatment, empirical therapy can be performed, and eventually need to transit to target therapy. Antibiotics should be used reasonably according to drug-sensitive experiment. And other treatment include surfactant replacement, glucocorticoids, and others. That's all. If you have any question, you can contact with me via the WeChat or email. Acute lung injury is very common, and it's also difficult to understand, and also difficult to deal with. But proper treatment of acute lung injury is very important to ensure the safety of surgical patients. So I hope you can learn and summarize the disease in your future work to ensure the safety of your patients. Thank you for your attention.